this is an amazing turnout, probably because the sun didn't turn out as promised today, but I'm very, very pleased that you're here. You are a group of people who are champions in the fight against hunger for Minnesotans and working hard to reduce poverty in Minnesota. This is an official listening, and I'm here to listen and take concerns and comments from you back to Washington. We're doing that through a terrific panel of elected federal and state officials who are going to be up here listening on and off throughout the afternoon. But most importantly, we're going to hear directly from local government officials, nonprofit organizations, our faith community, all, as I said earlier, combated people who are committed in battling hunger. I want to just kind of move into a little bit of why I'm doing the listening today. As many of you are aware, Congress is right now in the process of moving the 2013 Farm Bill. We will likely have that reauthorization of agriculture and nutrition programs on the House floor next week. That is the week of June 12th. Currently, the Senate is taking up their version of the bill, and Senator Franken left an earlier event with Secretary Vilsack to go back to Washington to be there to vote tomorrow, later today and tomorrow. Congressman Ellison and I, and he's on his way, are hosting this discussion, and as I said, we want to hear directly. We want to hear your comments and take the testimony from the providers and beneficiaries of the Supplemental Nutrition Assistance Program called SNAP. That is authorized and funded through the Farm Bill. Now, Minnesota, as we all know well, is an agricultural state. We've got the state steel right in front of us with the farmer. Farming is a vital element of our economy, both the production and processing of agricultural commodities. But we are also a state with 500,000 children, working families, seniors, and people with disabilities who are living in poverty, and they are in need of nutrition assistance to prevent hunger. The Farm Bill that passed out of the U.S. House Agriculture Committee last month cuts nearly $21 billion from SNAP. That's $21 billion in food assistance over the next decade. It eliminates nearly 2 million low-income people from receiving food assistance. And in Minnesota, we think that that number is approximately 30,000 Minnesotans. But because of the adjustments that are made in this formula in SNAP, it would also cut more than 200,000 children from the school lunch program. And as I'm sure we'll hear from some of the testimony here, sometimes that's the most nutritious meal the children receive during the day. The net result is obvious. It will mean more hunger in America, more hunger in Minnesota. I believe that that's wrong and it's unnecessary. And in my opinion, it is also immoral. The Republican leadership in Congress continues to recite their mantra of cuts, cuts, and more budget cuts. The Ryan Republican budget plan that passed earlier this year cuts non-defense spending by $5 trillion over the next decade. Of those cuts, 60% come from programs and services that serve low-income and moderate-income Americans. Meanwhile, the tax breaks for the wealthiest Americans are locked into place, and we haven't seen any tax reform on the agenda, just cuts for the middle class and the working poor. The policy that inflicts hunger on poor children and seniors in order to reduce government spending is cruel and, as I said earlier, immoral, and it's just not very smart. Now, one of our Tea Party Republicans in the House went as far to say, when talking about cutting SNAP, used a Bible quote to make his point in committee. Quote, he said, and he said this is from the Bible, "The one who is unwilling to work shall not eat." Now, obviously, my colleague does not seem to understand that the overwhelming majority of people on SNAP are children, seniors, and working families. The irony and the hypocrisy of my colleague's statement is that he personally receives as much as $3.5 million in direct agricultural payments from the federal government. True. Yet he wants to take food away from poor children and families. The witnesses that we will hear from today will tell us the truth about hunger and poverty, and how one of the most effective, efficient government programs that the federal government has ever implemented is at risk. I look forward to carrying your message back to Washington to use it in this fight to protect SNAP and our neighbors who depend upon it. And as I said, this is a listening. I don't want this to be anecdotal. I want this to be facts, and you folks are here to present the facts. They will become part of the public record, part of the official House Journal. When I get back, I will be submitting them for the record so that when I refer to them on fights on the floor and in committee, I can say, I have the facts, and these are the people in Minnesota and their opinions. So what I'd like to do, in keeping with traditional House style, is let my colleague from Minnesota, the representative, have a few words, and then we will ask the first panel up. So glad to have you with us, Representative.
Well, thank you very much, Representative McCollum, and I am really honored to be here, and thank you very much for holding this meeting. As everybody knows, we've concluded our legislative session for the year, and we're thankfully in a very different position here in Minnesota with regard to doing things to help working families, helping the needy, and so on. But obviously, we are always very much dependent on what happens on the federal level. And the SNAP program in particular is a big concern, because you're absolutely right that here in Minnesota we have plenty of folks who are working as hard as they can and yet not really getting by. And in particular, when it comes to the children, we know that whatever sorts of stereotypes people sometimes like to float about folks who need assistance, everybody has to understand and recognize that children don't choose their families. So although we reject the stereotype that says that somebody who needs assistance needs it for some fault of their own, although of course that can sometimes be the case, but most often not. Most often we've got folks who are working as hard as they can and trying to do right by their families. And it's been a very difficult economy for many people. Even people who have jobs are often not working, finding wages that really help them get by and be at the level that they really need to be. So the idea that the federal government would be cutting the funds that support food for children, school lunches, and food for seniors, and food for the working poor is really very disturbing, because we still are a country of plenty. And the real question for us is, what kind of community are we that we would do that to the people among us who need our help? So thank you again for presenting this today, and I'm really delighted to be here with you.
Thank you. We are joined, not by Keith Ellison, who's coming, by the Lieutenant Governor. Good to have you with us. I was with the Governor this morning when we were talking about the importance of passing a good farm bill at the University of Minnesota St. Paul campus earlier. Would you like to make a few comments?
Sure. Congresswoman, thank you very much for being here. This is much appreciated. Well, one of my major initiatives as Lieutenant Governor has been work with the senior population, and it is a population that is exploding, so that by the year 2035, the population of retired persons will be double what it is now. And what we do know is not only are there more, but they are living longer. And so it's important for us that they be healthy as they're living longer, because we need them to be engaged, that we need them to be viable, we need our senior population to be healthy. Otherwise, it can become an unsustainable drain on our budget in terms of taking care of the older population. And so a lot of my initiatives have been educating the senior population, and also trying to help them understand how they can live out their lives with more quality of life. But what we find is that there are a large population of seniors do not have the nutrition that they need. And the SNAP program is a great program for helping them to have adequate nutrition. And we're finding now that it's even an educational process, because there are over 50% of seniors who are not making use of the SNAP program who are eligible for it. And as I said, proper nutrition leads to good health, and we want our seniors to be healthy. So I'm very concerned about that aspect of the Farm Bill.
Good. And we're joined by a Representative Erin Murphy. Erin, would you like to say anything before we start?
Very briefly. The good, and there are so many reasons that it is a delight to serve in elected office, but one of my favorite is the ability to get to different parts of the state and to actually get off the highways and byways and into neighborhoods and small towns and communities all across the state of Minnesota. And in 8 years, I have learned that poverty and hunger exists all over the state of Minnesota. We might not always hear about it from different representatives, and certainly when we worked on healthcare and healthcare reform in my early term, when we were out talking with hospital administrators, those representing the homeless, et cetera, we learned that there are programs available and pockets of people who are hungry all over the state of Minnesota. In some places, people too proud to avail themselves of what's actually possible. And certainly lots of people relying on those things that are being made available through both the work of organizations that are going to testify today, and then the work that's happening in Congress and the work that happens in the Minnesota legislature. And I think that while we might not see it on a day-to-day basis, because people with pride will often not reveal themselves to their communities, we know it exists, and because of that, we need to continue to pursue solutions. I was really glad that you decided to hold the hearing today, so that we can hear from Minnesotans.
Well, thank you. I want to set this table, so to speak, about statistics that often get said in different ways, percentage of poverty, income, and we're going to hear many different statistics. But here's just a couple of things to keep in mind as our panels proceed forward. 10% of the state's population, that's 1 in 10 people, so look around the room, count to 10, 1 in 10 people need to have SNAP as part of their nutrition support. 68% of all participants are families with children. 26% of all SNAP participants are families with elderly or disabled members. And 44% of all SNAP families, well, they're working families right here in Minnesota. As I said, there's many ways in which to describe people who are part of the SNAP program. In Minnesota, 82% of households receiving SNAP have an income below the poverty line. Now, below the poverty line is $22,000 for a family of 4. So quite often when people are talking about percentages of poverty, it sounds like, well, maybe that doesn't sound so bad. So the families that we're mostly focused on here, if you just put this in the average, it's a family of 4 living on $22,000. 41% of the households are in deep poverty, with incomes even lower than that. So I'm joined by my brother, my colleague from the other side of the river. Keith, I told him we're having a listen, so you and I can take this back and put it in the official record. Keith is not only one of the Minnesota Twins here, so I'll let you do the close-up. We also are very fortunate to have Keith as a strong voice as the chair of the Progressive Caucus. Congressman Ellison.
Thank you, Congresswoman. I appreciate it. And I want to thank you and everybody who's here participating today. The greatness of the United States and of the state of Minnesota is not only a matter of big mountains, nor is it just a matter of great rivers or awesome physical beauty of our country. It's not just a matter of our military or our big economy. The greatness of this country is found in our capacity for compassion for people who are struggling and who are vulnerable. That is a measure of who we are and what we're about. By that measure, we all need to be concerned by $20 billion in cuts to food stamps, supplemental nutrition. It interferes not only with the individual families who depend upon these important benefits, but on all of us and who we are as a nation. The testimony we're going to hear today is going to highlight the effects of these cuts and how they will impact the most vulnerable among us. We're fighting against eliminating basic food aid for approximately 2 million people, most of them members of working households and senior citizens. Very important point that the Congresswoman made is that so many people who receive food stamps are working people. And the problem is not them, it's that we're not paying adequate wages. Wages have not kept pace with what families need to make it. We're also fighting to stop 210,000 low-income children from losing access to meals at school. The House Republican Farm Bill gets nearly half of its cuts in from denying food aid to people working and living in poverty. With the economic downturn, there's been an 88% increase in SNAP program participants since 2008. Right now, 550,000 Minnesotans use SNAP and benefits over 10% of the population. This is important to bear in mind. The House proposal will cause 32,000 Minnesotans to lose their SNAP benefits. Critics have said that this program has grown too big, but it's obvious why people would use a basic social insurance program in times of economic stress. And it's obvious how the government can spend less on helping the poor with basic foods. And it's obvious that we could try to reduce expenses by cutting aid to the poor, but it would not fit with our moral architecture or with who we are and what we represent as a state. We must promote programs that help individuals gain economic independence, which is precisely what SNAP does. SNAP helps kids do better at school because hungry children cannot focus on learning. It also lowers health care costs because of lifelong benefits of proper nutrition. The testimony today will support the fight to maintain a program that is working well. Since 2003, the error rate in SNAP payments has dropped 43%, saving the federal government $1.5 billion a year. And we can balance the federal budget we cannot balance the federal budget on the backs of the poor. If anything, we should be expanding this great program. Thank you, Congressman McCollum.
Well, thank you. We're also joined, and he has been so gracious so we can get to the panel, not to speak, but I would like you to introduce yourself and say what your district is, please, sir.
Sure. Representative Raymond Dean. I represent District 59B, actually the district that Congressman Ellison used to serve in.
Well, very good. Our first panel, if they would come forward, is Dale Simonson, SNAP Director for the State of Minnesota Department of Human Services, Commissioner Mary Jo McGuire, Ramsey County, Jennifer D. Cubilas, Assistant County Administrator of Health. If you'd please come forward, they're each going to spend up to 4 minutes. I have an official timekeeper here, so you can direct all your, disappointment to Jennifer on my staff when your time is up. And Keith will introduce the second panel. Please.
All right, I'm Dale Simonson, and I'm going to give a brief overview of the demographics of SNAP recipients statewide. You've heard most of them, but there's approximately 454,000 adults and children on SNAP and approximately 259,000 cases. Children make up almost 48% of the SNAP population. Out of these cases, there are 77,417 SNAP cases that include children. And out of these working families, 66% of these family cases have reported income from work. There are about 40,000 senior cases on SNAP, and the average age is 70 years of age, and 61% of those cases had income from retirement, survivors' disability insurance, or RSDI. There's about 88,000 disabled cases on SNAP, and there's remaining 62,000 cases that are categorized as other adults, and within this category are the able-bodied adults without dependents, or ABODs as we call them. The average benefit per recipient is $118, and per case it's $245. Race, ethnicity, demographics of SNAP cases are 59% white, 24% black, 7% Asian, 4% Hispanic, 4% American Indian, with multiple races comprising the rest. That's just a very brief overview of the SNAP population in Minnesota, and the data that I use today comes from the characteristics and people and cases on SNAP in December 2012, as well as the Family Self-Sufficiency Report, and both of these reports are available on the DHS public website. However, the biggest impact on SNAP recipients in Minnesota would come from the proposed restriction in the House bill on the state ability to use categorical eligibility. Broad-based categorical eligibility is a policy that makes most households categorically eligible for SNAP because they qualify for a non-cash TANF-funded benefit. This allows states to raise the income limit up to a maximum of 200% federal poverty guideline and raise or eliminate the asset limit. The Minnesota legislature passed a bill effective November 2010 allowing expansion of broad-based categorical eligibility for all SNAP cases by increasing the income standard from 130% to 165% of FPG, and which is federal poverty guideline, and also eliminated the asset limit. Section 4005 of the House bill would remove this option. DHS estimates that 6.4% of the caseload, or 16,700 cases with over 32,000 people, would be made ineligible because their income is above 130%, yet below 165% of federal poverty guideline. And of these cases, over 8,000 are family cases that would be ineligible due to over-income. The children on these cases would no longer be automatically eligible for free or reduced school lunch. DHS no longer collects asset information for SNAP, therefore we do not have data on the number of cases that would be ineligible due to being over the asset limit. The House bill also provides permanent reduction in funding for SNAP education. This proposed cut comes on the heels of the program's fiscal year 2013 budget cut of 28% that was included in the fiscal cliff agreement, resulting in decreased program activity. Minnesota's current allocation for SNAP Ed is about $7 million, and that includes the cut that's already been taken. And further cuts will impact the reach and impact of SNAP that SNAP Ed has on Minnesota's population and poverty. SNAP Ed is delivered by community nutrition educators from the University of Minnesota Extension Service and the Minnesota Chippewa Tribe. They use evidence-based, behavioral-focused curriculum to help Minnesotans with limited financial resources stretch food dollars and make healthy choices. In fiscal year 2012, the U of M Extension offered SNAP Ed programming in 84 out of the 87 counties, directly serving about 65,000 people, and in that same year, the Minnesota Chippewa Tribe offered SNAP Ed programming on 6 reservations, directly serving 6,778 persons. The U of M Extension program evaluation outcomes points to be very positive as far as changing the eating behaviors in people. These are the 2 major provisions that will have the greatest impact on low-income Minnesotans on SNAP if these cuts are adopted. Thank you for your time. Did I make it in 4 minutes?
Yeah, well, a little over 4. Keith and I are from the House of Representatives, and if you watch us, they time us. They never time the Senate. So we're going to give them an A. Yeah. You fell within the guidelines. Commissioner McGuire, thank you for your testimony.
Thank you, Madam Chair, and I hope I do as well as Mr. Simonson did. Congresswoman McCollum, Congressman Ellison, Lieutenant Governor Pretner-Solon, and distinguished members of the House of Representatives, thank you for the opportunity to join you today and discuss the proposed cuts to the Supplemental Nutrition Assistance Program, known as SNAP, in the 2013 Federal Agriculture Reform and Risk Management Act. I appreciate that you've pulled this together and that we're talking about this very important topic. As you know, budget decisions made at all levels of government have a direct impact on our counties, our communities, and our families. Overlooking the importance of providing this type of financial assistance to households is short-sighted, and I think we can all agree with that. And I encourage members of Congress to look beyond the numbers on a spreadsheet and consider the real-life implications of cutting this very important program. I want to share with you how the proposed cuts to SNAP will impact Ramsey County. Even without the proposed cuts, Ramsey County has seen a dramatic growth in the number of people who receive SNAP benefits. As between 2008 and 2012, there was a 56% increase in individuals receiving benefits, with a record high of almost 120,000 people who received SNAP benefits for a few weeks or months at some point in 2012. This means almost 25% of people currently living in Ramsey County participated in SNAP. This is a statistic that cannot be ignored, and it must be helped. In addition, over the past 9 years, the county has seen an increase of 168% of cases on average per month, growing from 12,600 to almost 34,000 cases. The Ramsey County Human Services staff has been able to maintain a high level of service to our residents, but at what point will our shrieking resources be exhausted? We need to do better. Nationally, 45% of individuals receiving food support are children, 9% are elderly. A cut in benefits of only $20 to $25 a month will mean households in Ramsey County that include 25,000 children, 7,100 seniors, and 16,500 disabled adults will have to choose between paying rent, paying the electric bill, or buying food. For example, a family of 3 would lose 11 meals per month, and a family of 4 would lose 14 meals a month. This is 1 meal every other day, and this is unacceptable. This does not include the decrease of $10 to $15 a month per person that will occur on November 1st of this year. As children attend school without the needed nourishment, educational attainment suffers. Job prospects post-graduation can be narrowed, and employers have a reduced pool of individuals with the skills and knowledge to fill the jobs that can grow their businesses. 41% of SNAP participants live in households with jobs, and only 8% receive other cash assistance. This demonstrates there is a desire to work, and we should be encouraging that with steps to make sure families have adequate nutrition and not creating additional barriers. My colleagues and I on the Ramsey County Board are focused on addressing the growing concentrations of poverty within our county. We cannot make progress if more households are forced into poverty. As our economy continues to recover from the recent downturn, investments in infrastructure, both physical and human, are going to be key for continued job creation and growth. Increasing the strain on households and raising the levels of poverty in our communities will not be beneficial to long-term economic recovery. Thank you again for the opportunity to speak here today. Thank you, Congresswoman McCollum, for your leadership on pulling this panel together and on the issues that are important to our community now and in the future.
Thank you very much. You need to introduce yourself for the record.
Jennifer DeCubelis, Assistant County Administrator in Hennepin County for Health. Thank you for the opportunity, Lieutenant Governor, Congresspeople, and representatives, for the opportunity to speak here today. Hennepin County has made significant gains in systems integration to improve the health of the residents we serve and to reduce costs. However, current funding cuts in the area of food supports, health promotion, and maternal and child health have us increasingly concerned that these cuts will result in significantly higher health costs at a time when we are making critical gains in turning the health cost curve. Hennepin County launched an innovative healthcare model for its lowest income residents in January of 2012 in partnership with the Minnesota Department of Human Services. The program, Hennepin Health, is aimed at improving the health of our lowest income residents, where health disparities are the greatest, where services are highly crisis-driven in our emergency departments and in inpatient sectors. What we have found with Hennepin Health is the tremendous role that socioeconomic status plays in health and in health access. In looking at individuals utilizing the greatest amount of health care services, there's a tremendous gap where the economic barriers result in the inability for individuals to make healthy choices. From lack of transportation for preventive services, resulting in higher cost emergency care, to lack of affordable housing, resulting in transient populations who are difficult to engage in preventive services, to lack of food supports, resulting in poor nutrition, obesity, unstable diabetes, and a magnitude of health conditions which are exacerbated, hence increasing overall health costs. The premise of our health project is treating patients' medical problems without addressing underlying social, behavioral, and human service barriers and needs produces costly, unsatisfactory results, both for the patient and for the programs providing and paying for the care. According to the Centers for Disease Control and Prevention, 50% of the influence of health status is healthy behaviors. Eating well is one example of these. What we found in the last 18 months is the criticality of meeting people's basic needs first in order to get their attention on health care. We spend a lot more in health care trying to solve medical problems when the underlying issue for what health care often calls noncompliance is really barriers to health due to unmet human service needs. One example I would provide is a physician who recently came in and said he'd been treating a woman for 3 years, and he had her as non-compliant with her medical care. We had a community health worker beat him into the room one day just because he was running a little behind. And what she found out is she came out and said, "Don't worry about it, doc. I got it taken care of." She didn't have food supports at home, and he was going to act on that and was running down a path to help her out. What that physician said is it was remarkable. I walked into the room with a woman who I'd been seeing for 3 years, and I saw a totally different person. She suddenly was willing to engage in what medications are working, how do we get a treatment plan for her healthcare needs, how does she address what we wanted in the healthcare side. And the basic premise behind that was we took care of life stressors first. I would give you another example. A person struggling with hypertension is less likely to worry about taking their medications to regulate their blood pressure when they're concerned where their next meal is going to come from. The pill does not give them immediate satisfaction. However, food does. Not taking the medication, however, exacerbates the condition and increases our health costs over time. We'll give you another example. We learned early on from Mary, who had a high number of hospitalizations. She was not taking her medications consistently because they upset her stomach. We had, again, a physician working diligently with her to try to find a medication that didn't upset her stomach, until we slowed down long enough to find out that what was really bothering Mary was she didn't have consistent food. She was taking medications 3 times a day was what was prescribed, and because she didn't have the food supports to be able to eat 3 times a day, she was inconsistently taking her medications or taking them only when food was available. Again, increasing her health concerns, increasing the cost to the healthcare system. I would emphasize that lessening access to food supports creates lives in crisis. Lives in crisis escalate our healthcare costs. With 2/3 of the country obese or overweight, access to healthy foods and education on healthy behaviors is imperative. In 2008, Minnesota spent an estimated $2.8 billion on obesity, and obesity rates continue to grow. In Hennepin County, we have community transformation grants that are targeted to reduce several health concerns. Reducing the rate of obesity is one goal. However, these funds are also facing significant cuts. Teaching children healthy decisions and choices at a young age is critical for us to address healthcare concerns in the United States. Yet fast food is often our cheapest option, leaving our lowest income residents with the highest obesity rates, with 8% cuts in the WIC program. Getting healthy starts for women and infants will also be increasingly challenged. Healthcare reforms are looking at means to reduce costs and improve health outcomes. By front-loading social services and food supports in a healthcare model, we have realized a greater than 10% reduction in healthcare costs. This would not be possible without leveraging human service supports. Our greatest examples of success in healthcare are when healthcare and human services come together as a unified solution. Food supports, meeting basic human needs, more than pay for themselves with these kind of numbers. Removing them, conversely, will have substantial impacts on healthcare costs. If we want people to make positive healthy choices, we need to ensure they have the tools and the resources to do so, or we all will pay more in the end. Thank you.
Thank you. We're joined by my representative, Representative Rita Moran. Good to have you here.
Thank you.
We have a few minutes in which to take questions for each panel. I know Keith has a really good question. Keith, you're typing away here because you're instantly tweeting out. He's a much better speller than I am, so I'm not tweeting. I'm having somebody else do it. It'll spell right. But I do have a question for the state of Minnesota. One of the things that I know that Representative Peterson's trying to work on in a positive way is a couple of things you alluded to, and that is changing the way in which assets are counted. For example, being able to have more than $2,000 in your savings account and having a car that's reliable to start in the winter. Could you maybe speak to one or two of the, and there's very few good things in this farm bill when it comes to the families, you know, in Minnesota that we're talking about today. But maybe explain a little bit about what that's going on so that I can speak to those good things that Representative Peterson really is trying to make a difference with.
Congresswoman McCollum, I think with the categorical eligibility, the broad-based, what the state legislature and the current Farm Bill allows us to do is to adopt the broad-based categorical eligibility, and eliminating the asset limit completely is really the best solution to this. Anytime that you have an asset limit, even if we were to increase it to $5,000, you know, for cash and to have no value on a vehicle, it still brings a barrier to people applying for assistance who need that assistance. And I'm particularly concerned about an asset limit for the senior population, because these are people that have often been income eligible all along for SNAP, but until 2010, when the legislature eliminated the asset limit for SNAP, they became asset eligible. And I say that because they had their life savings of a certificate of deposit of maybe $10,000, which was their entire life savings, and they would never ever spend that money on food because that was not a true emergency. They would save that for what, you know, the broken hip or that really big emergency in their life. And so that's where I feel that just eliminating the asset limit completely is really valuable. The other thing that we have found, and I don't have, we haven't done a real study on this, but many of the SNAP population are currently on health care, and health care does have an asset limit. And so we're going to find that by eliminating the asset limit and removing that barrier for SNAP, these people are still asset poor. They're not going to have a whole lot of assets, especially for the working families that are on our program.
One other question I would have for you and for the counties is, I know when we were working on the first welfare reform piece of legislation, I was over in the other building working on the House of Representatives, and one of the things that kind of came to light is all the duplication in paperwork, all the extra processing, the extra bureaucracy that went along with it. So one of the things that we had been looking at, and I know Minnesota was a leader in doing some of the things, is if you qualified for SNAP, then your child all qualified for free and reduced lunch. If you qualified for SNAP during a hard, difficult time, probably meant you were going to need help with your heating oil, or however you heated your home in the winter. So it made some eligibilities. Can you tell me, or if you would have a comment as to, there's talk about not having that anymore. Is that going to take more money away from directly serving children and seniors and our brothers and sisters with disabilities, and actually create more government, more bureaucracy?
Well, I think anytime you introduce an asset limit, each program has their own asset limit, and each program looks at assets a little differently, whether it be healthcare or whether it be your TANF program or some of our state-funded programs. And so it is really confusing for our applicants when they're eligible for one program because they're under the asset limit, but they don't meet the eligibility requirements for some of the other programs. Now, as far as the LIHEAP or the Energy Assistance provision, if people are eligible for the SNAP program, they are eligible for the Heating Assistance Program, and we are able to, work with our community action agencies and get those people on the heating assistance and so forth.
Keith, I know you had a question before we bring up the second panel.
Yeah. My question is, many people listening to this conversation might say something like this. Well, Yeah, SNAP cuts aren't great, but we know that churches and mosques and synagogues and other faith communities and food shelves will step in, and it'll all just be fine. How do you respond to that kind of thing?
I'll just start out by saying that we know and we appreciate all the work that the nonprofits, the churches, that they do contribute, and they are helpful in this, but the need is so much greater than they can provide. And so we absolutely need the steadiness of this program to ensure that families have what they need. The nonprofits that we've experienced, it's emergency and all too often it tends to be more ongoing, but we know that they can't provide all the services that are needed. And
I would echo that the linkages with healthcare and human services program being able to work seamlessly together is the criticality, and community partners are absolutely important in reaching out in communities, but it will not cover the need, which means we spend dollars elsewhere.
Is it fair to say that those faith communities and other charitable organizations are already stretched pretty well now,
right.
before these $20 billion in cuts might go in?
Absolutely.
So if we do it, it's even just going to make everything that much worse. Thank you very much.
Absolutely.
Thank you very much.
Thank you very much.
And now I'd like to call forth our second panel, and just like to join everyone in thanking Congresswoman McCollum and pulling this hearing together. It's so important. Congressman McCollum's been a great voice on this issue, and particularly acute on the issue of health care. I'm sure you were focusing quite carefully on that. So we'd like to ask Colin Moriarty, Executive Director of Hunger Solutions, to join us. Evelyn Shelifo, Senior and SNAP beneficiary. Erin Pavlika is a married mother of 3 children and a SNAP beneficiary. And Tyler Lindroth, homeless adult, teen, and SNAP beneficiary. So I want to thank all of you for coming today, providing some real-life testimony, and we'll start off with you, Ms. Moriarty. Thank you.
Thank you, Congressman Ellison, Congresswoman McCollum, Lieutenant Governor, members of the House of Representatives. Thank you so much for holding this forum today in the face of these tremendous burdens that are about to be felt by members of our state and throughout our nation. Hunger in Minnesota, as you know, continues to be a concern. In the last 5 years, hunger has doubled in the state of Minnesota. Long-term unemployment has caused previously middle-class families to turn to food shelves to answer their food needs. Food insecure households, as you heard earlier in the testimony regarding health care, is causing people to make choices between food and medicine, food and heat, and food and education. We're lucky in the state of Minnesota. We have a stable emergency response. We have nearly 300 neighborhood-based food shelves throughout the state of Minnesota. Statewide organizations like mine, who work with them, help to make groceries available to purchase for families who could not afford their own. But the statewide growth in food shelves has increased 164%. Currently, 8,200 people a day seek assistance from food shelves in the state of Minnesota. That's over 3 million visits a year. As many of us have heard in the news recently, poverty is growing more quickly in the suburbs than it is in some of the urban core areas. The numbers of suburban Twin Cities residents living in poverty has more than doubled over the last decade. There are 115,000 more people living in the Twin Cities suburbs in poverty than there were 10 years ago. We've seen this growth in poverty since 2000 in the metro, and we've seen it in the suburban food shelves as their demands for increased services have steepened. Visits to suburban food shelves have jumped 89% since 2008. And the SNAP usage is up 68% in the suburban food insecure households from 2008 to 2011. Unemployment needs, long-term unemployment, leads to foreclosure, depleted savings, IRA spend downs, and maxed out credit cards. These families have looked to anything but the government for assistance. While there's nothing to eat and your resources are depleted, your first stop is a food shelf. Yet, only 1 in 24 bags that are handed out to families and to people in need in the low-income areas of our state comes from charity. The rest comes from programs like the Emergency Assistance Food Program, which is contained in the Farm Bill, from large donations to food shelves, and from the support that comes from the national programs. We've developed new ways to reach the newly poor. We focused this with General Mills, with other corporations, with the Department of Human Services on doing SNAP outreach. And every time we move to make the program more complex, every time we move away from simplicity for this program, we put more stigma on the people who are taking part in it. The program has expanded and contracted according to the economy. It's done exactly what it was designed to do. And as economic times improve, we'll see the program lessen. But the fact is, when the stimulus program was first put into effect, the SNAP program was one of the first places, along with unemployment insurance, that the federal government looked to be responsive to people in need. And that's because the program works so well. SNAP and other local resources must work together. Our food shelves, our meal programs, and our capacity to serve the poor in this state is directly related on our success of having a farm bill that represents the poorest and the most needy in our country. Thank you very much.
Thank you, Colleen.
Good afternoon.
Colleen, would you move the microphone a little
As a
closer to
senior,
Ellen?
of course.
Thank you.
And can you hear okay?
Yes.
Okay.
Yes,
Thank
ma'am.
you.
I'm Evelyn Chalafo. I'm new to the SNAP program by only a couple of months, actually. And I can't thank the program enough for being available for me and some of my neighbors also. I live in a senior building, and I am a diabetic who's on insulin, which, of course, as anybody that knows a diabetic knows, is way out of sight as far as price. And also other genetics that are generics for some other illnesses. Because of an injury that I had last December, I was forced to retire, which wasn't by my planning at all. I had hoped to work at least a couple of more years. Because my insulin is so expensive, starting last month, May 1st of 2013, I'm now in the donut hole or coverage gap, whatever you want to call it, and I'm going to be there for 7 months this year. It's really taken a toll on me because I pay out of my pocket every month $646.80 being in that donut hole. I'm on Social Security, of course, and that's all. Without the help from SNAP, I wouldn't be able to buy some of the healthy foods, the fresh, fresh fruits, fresh vegetables, and so forth, trying to keep the diabetes a little bit in check. This is a daily thing, of course, and always a challenge. If they lower, like they're talking, they want to lower the availability, your availability for a SNAP, I really don't know what I'm going to do. Don't know how I'm going to be able to purchase the meds that I'm going to need. I'm down as low as I can go right now. I apologize.
There's nothing
That's
to
okay.
apologize for.
It's all right, Evelyn, you take your
You're
time.
speaking for millions of Americans all around the country, and we thank you for that.
That's right.
I'm sorry. Thank you for your time.
Thank you.
Thank you, Evelyn.
I have to compose myself here.
Sorry. I'm sorry.
My name is Erin Pavlica. I live in the Midway of St. Paul. I'm a homeowner for 13 years there. Thank you for having us here. This is the real people that this affects, and I think it's brilliant that we're here. This is Quinn, who was sleeping the entire time until I got up here. So if she tries to grab the microphone, I apologize. But most of you know that the Farm Bill only makes up 2% of the overall federal budget. Although SNAP uses 80% of the federal funding within the bill, it is still minor compared to some of the spending that is done in other areas of government. The cuts that are proposed will drastically affect a family like mine. Families with small children, this is my third child. My other two didn't want to come. They're with neighbors playing. I tried, but you're probably happy that they're not here. My husband's working hard to build up clientele to make our independent business successful and bring home necessary cash flow in order to live. There's a misconception that all SNAP users don't work and are abusing the system. This is just not true. My husband works hard outside the home as a photographer, often 6 days a week, while I'm at home continually finding ways to save energy, reduce resources, and farm our land, our little urban plot, with our very modest income. We are a family of 5 with 1 car that bikes, walks, and uses public transportation like I did today. I volunteer within our community to bridge food desert gaps, create friendly streets where cars and bikes get along, continually build community through our neighborhood festivals, and strive towards zero waste. I'm teaching my kids how to grow food for the future. I also serve on a board of a nonprofit that helps low-income families like mine replace outdated appliances and pay for energy bills. So my family is just not continually taking. We are giving back, and we are thankful every month to receive our SNAP benefits. Perhaps what this bill needs is a revolution of sorts, and not just more cutting of funds. I personally stretch my SNAP benefits by using the farmer's market, where I can buy plants to grow herbs and veggies that I need all season long. The beauty of this is that I'm supporting local growers and independent family businesses like mine. I buy as much locally grown and produced products I can at our co-op. I buy whole grains and beans in bulk, and I'm committed to cooking from scratch as much as I can. I take that big ag money and I put it right back into my local economy. We need to spread the word to SNAP beneficiaries that seeds and vegetables and plants are allowed with their benefits, because not a lot of people know this. We need to bring more fresh produce into areas that lack grocery stores, and we need to teach people how to grow their own food again. Please consider my family when you think about the Farm Bill. Thank you.
Thank you. Tyler?
All right, hello everybody. My name's Tyler. I'm 19. I've been homeless for about 2 years now. Started when I was 17, trying to get through high school. You know, it's a tough time to go through. You know, I got my first job and I had a choice. It was work or go to school. I tried to do both, failed out of school. So, you know, did the only reasonable thing, looked for more work. My jobs fell through, got another job, didn't work out. My car wasn't good enough, wouldn't start, wouldn't get me to work. I fell flat. Trying to finish school now, you know, without SNAP. I just got it a couple of months ago. Without that, I don't think I would be eating over the past couple of months. Luckily, I found out about the Manna Market to help me a little bit, but it's been hard. You know, I'm on my own right now. Dad doesn't help me, Mom can't. It's a tough economy. You know, I've been taking from this program more than I knew with the school benefits, probably throughout entire grade school, middle school, and high school. I had free lunch and breakfast. Without that, I probably wouldn't have eaten either. So, you know, this program has helped me my entire life so far. You know, and my goal one day is to just get into college and put back into the same program that I'm taking from. But that's hard to do when you know, don't know where you're gonna sleep, don't have a family to go home to. So I thank everybody here for pushing for this program, and that's all I have to say.
Well, I want to thank everybody on the panel, and I think it's important to point out that you, in fact, are speaking for millions of Americans. So while I know it's personally taxing for you to have to come and tell your story, it's a brave thing that you're doing because you're giving voice literally to millions of Americans. So thank you for doing that. Thank you for doing that. So now I think
Keith,
questions.
we have some time for questions, and I thought maybe we would let some of our colleagues see if they had a question. We have about 10 minutes for questions. Does someone, Lieutenant Governor? Oh. Go ahead.
Yeah, well, good afternoon. First of all, let me thank all of you for coming here and echo what the congressmen have said, that we really appreciate that you're here and that you're speaking for many. And especially, I think you're putting a face on something that we all know exists, but that many Minnesotans and many Americans would like to believe doesn't exist. And that is the truth, that any of us can need a little help. Any of us, just because of the situation that we may find ourselves in. So the question that I have, actually the question I had before was about the asset categorical eligibility, which was answered, so thank you, Congresswoman, for that. And so that was answered, but maybe each of you could just talk about how you found this program. I'm just kind of curious about how you found out it was eligible, that you were eligible, or that it existed for you, and what was your entree into it, especially those of you who said that it's, well, I think Ms. Shelifo, if I'm saying it right, you're kind of new to the program, so I'm just kind of interested in how you found the benefits and how the process of applying felt to you.
Actually, the applying was very easy. Joanne from SNAP came and helped me fill out the papers and everything. I had heard about it from a neighbor. About the same period of time, my son had called, one of my sons had called and said that he had seen something about it on TV, you know. And so I thought, well, okay, let's take a look, you know. I've never had to use anything, any program before. So I guess this made it pretty hard for me. I don't know if that answers your question, and I really am sorry.
Yeah, thank you. Yeah, absolutely. And you know, we're all right with you. And thank you for sharing. I know it is very tough, and this whole issue about how difficult it is to sort of to step forward and say I need some help. That's kind of what I am asking. How about our other testifiers? How did you find the program, and how did it feel to you to ask for that help and to be on the program?
You know, I knew about it through, I guess, the healthcare. My husband's always worked for small businesses, and then now he has his own business. So of course, healthcare, private health insurance is not within our reach at all. And so basically, I looked at the eligible, you know, the income limit, and was very happy that the asset limit was not with SNAP because of a 401k that plummeted and then came back up, which I think it goes back and forth. Sometimes they use it, sometimes, I don't know. And then I have a CD that has been sitting for 12 years. And of course, with 401ks, you can't really cash in on those without getting highly taxed. So it's not like it's liquid asset that I think. I mean, we could do it, but of course, this helps us be able to do car repairs with the money that's coming in, house repairs, you know, and not have to worry that, do I have to buy groceries this month? Or do I have to get something for the kids, or do something around the house that has to be done roof-wise or whatever? So yeah, I mean, I'm quite tapped into the community just in general, and I think it's for a lot of people, they don't want to ask for help. And for us, it means having that little bit of extra a month just in case. Yep.
Thank you.
I found it through the farmer's market or Manna Market. I've seen it on the buses and trains, so it was out there and I knew about it. I absolutely did not want to go for the program. The only reason I signed up for it was because the day I was at the farmer's market, I passed out and lost consciousness, and I decided then and there that if I don't treat myself a bit better, I might not make it much longer, so I decided that's what I had to do. We got it filled out before I even left the building, maybe 15 minutes, so it was really nice, and the program helps, so thank you.
Thank you.
Rena, did you have a question, comment?
No, I don't, but I just want to say that what you're feeling and the impact of having to come to ask for assistance is a huge barrier for so many families. And, you know, part of my belief and so many of our beliefs is that, you know, government has a place in your lives, you know, for times when it's hard like this, times when you've been challenged. And so it's just a matter of how do we continue to create the opportunity for families right now who are in need, who are in crisis, and who are hurting, so that you can live good, healthy, sustainable lives. And again, I just want to thank you so much for coming forth to testify. You are a voice for so many others who are voiceless or who don't have the opportunity and the chance to share their stories. So just really thank you so much.
Thank you. And, you know, one of the things that I'm hearing from the testifiers today is the temporary nature of the circumstances you're facing. And I think that's important for Minnesotans to remember and for Americans to remember that so often when people find themselves in need of help in their health care or housing or food support, it is the result of something that's happened in their life. As Ms. Shalafo, I want to make sure I say that right, explained, you know, an injury that meant you had to retire before you were ready. And the donut hole, which is going to close, but it's not closed yet for you, has created a situation for you that is temporary. And for most people, what we do together through the government is a way to help people bridge those gaps so that they can get back into the life independently like most of us are and most of us do every single day. And that's why it's here. So I think it's important for the record for us to all remember that and recall that we should be able to help each other out when we face circumstances, knowing that most Minnesotans are working very hard to achieve the independent status that they want.
Thank you.
Thank you.
Keith? Well, thank you very, very much. And I think she did a great job.
Oh, thank you.
Food. Hey. She's the reason why we're here, and so too often I find some of the colleagues that we serve with, Keith, just look at what's in it for them today, and our job, I believe, both morally and legislatively, to build a strong, healthy America is what's in it for the long haul. She's the long haul. She's our future. So thank you so much for bringing our future.
Thank you.
Thank
for
you.
having us.
Thank you.
Thanks.
Okay, all right.
So Keith is really going to get his question answered, I think, this time. We're going to have the faith leaders and service providers come up. Judith Tenenbaum of the Jewish Response to Hunger, Patricia Lal, Director of St. Paul Council of Churches, Mary Ellis, Director of Public Policy Manager, Catholic Charities of St. Paul and Minneapolis.
Thank you very much for the opportunity to speak to you today. My name is Judith Tenenbaum, and I am a volunteer and the co-chair of Mazon, the advocacy project in Minnesota. Mazon, a Jewish Response to Hunger, is a national nonprofit organization working to end hunger among people of all faiths and backgrounds in the United States and Israel. Mazon, which means food in Hebrew, was founded in 1985, and it is respected as representing the collective priorities of the American Jewish community on issues related to hunger. Rabbi Harold Kravitz of Adath Yeshurun Congregation in Minnetonka is the current national board chair. As in many faith traditions, Jews believe that we have a sacred duty to take responsibility for the vulnerable people in our midst. We read in Leviticus, "You shall not reap all the way to the corners of your field or gather the gleanings of your harvest. You shall leave them for the poor and the stranger." Mazon currently has about 275 grantees, mostly in the United States and Israel, and mostly to non-Jewish organizations. It also has 700 synagogue partners. Since 1986, it has awarded more than $66 million. And while Mazon has worked hard to raise that money, as Congressman Ellison noted, that is not a large amount compared to the need or compared to the capacity of the federal government. This money has gone to grantees, who range from food banks, food pantries, and home-delivered meal programs to advocacy groups working at the local, state, and national level. The burden on all of these grantees would be greatly increased by the proposed cuts. These cuts would create increased additional need at a scale that cannot be covered through charity. Private programs, while important and necessary, are no substitute for the systemic change needed to address the problems of hunger and poverty in America. For that reason, Mazon has prioritized advocacy and stopping the cuts to SNAP, one of the most successful anti-poverty programs. I would like to share with you excerpts from one story from Mazon's Faces of Hunger project that documented who in America is hungry and why. It is a good example of the way private programs and federal programs are both necessary for a family in need. This is the story of John. I feel bad when my mom tries to buy me some food and I say, "Mom, if you're not getting yourself something, then I'm not getting anything." It makes me feel sad that my parents sometimes feed us kids and not themselves. But it makes me feel happy that they care so much about my brother and me. I'm 10 years old. There was a period before we got food stamps when I was so hungry that it hurt a little bit in my stomach and kind of made me out of breath. I didn't tell my friends about our situation. It was a private thing. I got really bad grades in school then, and I was used to getting good grades. If I'm hungry in school, I can't focus a lot and I don't understand the lesson. I'm glad that the school I'm in now can provide us breakfast because you need breakfast to get you going in the morning. When I don't eat in the morning, it makes me drowsy, and I steer off in space just thinking about lunch. If I didn't get school lunches, I'd be a little disappointed because I might not have enough to eat. My life changed when we got on food stamps. We get food in the clearance aisle, and we don't buy anything at whole price. The food stamps we get aren't enough to feed 4 people for a month, so I'm always excited to go to the food bank. Sometimes there are things I really like, and sometimes not so much. I combine things to make them taste a little bit better and to fill up a little bit more, like putting cinnamon and sugar on the bread. We are stunned by proposals that would drastically cut funding for SNAP. Mazon believes that our federal government must function to address our collective responsibility to one another and carry out our national priorities. Our government is the strongest and most effective instrument for helping the American community. The government needs to fulfill its role of protecting the most vulnerable. Faith communities and charities can only be supplements to that.
Representative McCollum and Representative Ellison and all of you, it's a privilege to be here, and I thank you for this opportunity to address the difference SNAP at its current level as a benefit is making in all of our communities. I serve as the Executive Director of the St. Paul Area Council of Churches. We are a nonprofit representing 125 local communities of faith in Ramsey, Washington, and Dakota counties. We come from Christian, Jewish, Muslim, Unitarian, and Quaker backgrounds. We have lots of differences when we sit down and talk about doctrine, but we absolutely all agree on one thing, and it is this conviction: no more hungry neighbors. I'm here to say that to you again as a person of faith and as a citizen: no more hungry neighbors. In recent years, we as a country have made great strides in addressing domestic hunger, and I really do believe SNAP has been an important part of what we are doing well. It serves our most vulnerable neighbors, as so many of the testimonies have witnessed today: our children, our seniors, and our working families. It also serves them in a way that supports local economies, with dollars spent at grocery stores, and I was delighted to hear at the farmers market by two in the panel before me. It also energizes our children to succeed in school. It's economic development and investment for all of our futures. While I would side with those who say that it's important to balance our federal budget, cutting SNAP benefits to our most vulnerable neighbors should be absolutely the last option we exercise. The proposed cuts in both the Senate and the House forms of the bill will negatively impact all of us who work with families in poverty. Let me illustrate that. The St. Paul Area Council of Churches hosts an emergency food shelf for the American Indian community in Ramsey County. We provide food to 500 individuals enough. We hope each month that's enough for 6,000 meals among the 100 million missing meals in Minnesota. The use of our own food shelf has increased by 30% since last August. More families, more need, more demand upon us to do what all of us as citizens are asked to do, which is to provide for those who are at most risk. But I want to widen that perspective about food shelf participants. Some of our participants are also volunteers, and a couple of months ago it was still winter. We were short-staffed that day, and so an American Indian elder named Larry and I worked outside in the cold, helping to unload the delivery from Second Harvest, our food bank. Larry is a father and a grandfather. He is also a hard worker, and I can say before you quite honestly, he carried 3 to 4 times in the amount of food that I carried from the truck. But when that truck was unloaded and we had warmed up and all the food was put away on the shelves, I paused to thank him for all he had done. Larry looked me square in the eye, pointed to his heart, and he said, "I do this for the community." Those who receive SNAP benefits, those who will be excluded from benefits if these cuts are pursued, are our community too. On behalf of them, I'm here to say, no more hungry neighbors. Thank you for your attention.
Thank you. Marie?
Good afternoon. My name is Marie Ellis. I'm the Public Policy Manager for Catholic Charities of St. Paul and Minneapolis, and I'd like to echo much of what has already been said and share Catholic Charities' experience. I've been talking with staff throughout our agency about clients they work with who use SNAP and what the proposed cuts would mean to those clients, and there's a few different themes that have emerged. First of all, SNAP helps lift people out of poverty. It helps people lift themselves out of poverty. One staff member at our Family Service Center, which is a family homeless shelter in Maplewood, noted that clients she works with depend greatly on SNAP, and that if a family has housing stability, but their food support is cut due to these proposed federal cuts, money for food will need to come out of that budget for housing, or the budget for transportation, or childcare, or medicine, or other basic needs, and that in turn may cause them to lose their housing or their employment. Another staff person said the families she works with at the Northside Child Development Center in North Minneapolis are already making very difficult decisions on how to spend their money, and that cuts to SNAP would mean decisions about basic food needs would add to that distress. Does this $20 I have go towards gas to get to work or food for the week? And by the way, the average family at Northside Child Development Center is 1 parent and 2 children, and the average income for that family is less than $15,000 per year. So that SNAP amount of food support does make a huge difference when you're talking about an income level of less than $15,000 per year for 3 people. We also know that data supports these stories that we're hearing from clients about SNAP's effectiveness as an anti-poverty program. The Center on Budget and Policy Priorities found that SNAP kept about 4 million people out of poverty in 2010, including 2 million children. SNAP lifted 1.3 million children above 50% of the poverty line in 2010, more than any other benefit program. A second theme that emerged from these conversations with staff and with clients is that the amount a family receives in SNAP benefits only covers most of the family's food costs if the children receive meals at school or childcare and if there is no special dietary needs. Most of us know people who are gluten intolerant or diabetic, and we already heard from someone today who has to deal with special dietary needs. We also know that children are usually not in school during the summer, and so that parents must stretch their money to include 5 more breakfasts and 5 more lunches for each child during the week in those summer months. Another staff person at Catholic Charities who's worked previously in rapid rehousing said that the #1 referral families inquire about is food shelves because their SNAP funds just didn't cover quite all of their food needs. The third theme that arose is that clients and staff confirmed that a robust economy is critical for our clients, particularly those who are able to work. Minnesota's farmers, agriculture workers, and our state economy are SNAP beneficiaries. And as Representative McCollum said at the beginning, we're an agriculturally rich state, and so benefits to Minnesota are greater than even to other states. Jobs in agriculture allow many families to provide a roof over their heads and food on the table. And when rural families lose those jobs, they too often end up coming to the city and becoming our clients. Right now, a higher percentage of Twin Cities residents are living in poverty than has been true since the mid-1960s during the War on Poverty. SNAP caseloads are at a historic high in Minnesota. We've heard some of these numbers. We know the number of people eligible for SNAP in the Twin Cities has almost doubled since December of 2007. It's about 554,000 people eligible for SNAP in December of 2012. We also know that the number of children eligible for SNAP has increased by 160% since December of 2007. The time when more people need assistance is not the time to cut assistance. It's entirely illogical to create a program to assist people and then realize more people need assistance and then cut the program. That doesn't make any sense. SNAP does cost a lot of money. We know that. We recognize that, and we recognize that managing the federal budget is very important. However, costs associated with not providing this assistance would be much higher. One example, like I've said before, is that families on the edge of homelessness who need to use that money going towards housing now on food could put their stable housing at risk. And cuts to the government for providing emergency shelter are much greater than the cost of food support. And to respond to Representative Ellison's question from earlier about faith communities and nonprofits being able to pick up the slack, it is definitely fair to say that faith groups and nonprofits are stretched to our limits and simply cannot make up that $21 billion difference. Catholic Charities' vision is poverty for no one and opportunity for everyone, and cuts to SNAP will work contrary to this vision. Cuts in the billions of dollars will result in children's parents choosing between food and other basic necessities for their families. Thank you very much for the opportunity to speak today.
Thank you. I just have to, I wasn't going to say anything earlier, but it came up with every panel about the farmers market. The reason why Minnesota has that is of 2 outstanding senators, one who has left the Senate, and one who's still serving, Senator Ellen Anderson and Senator Sandy Pappas. In the House, it was Representative Becky Laurie and myself. But we couldn't have done it without the brother farmer who's sitting behind of everybody, Doug Peterson, who helped get the votes, along with Ted Winter in rural Minnesota. That's the reason why we have it. And they said it couldn't be done. We have some testimony from ARC Minnesota that we will be submitting to the record. In the back, there is an agenda, and on the bottom of the agenda has additional written testimony may be submitted to Jen Holcomb, who's right here, and her email address is here. So if any of you, after hearing this testimony, would like to add your own words, your own thoughts to be part of the congressional record, which Keith and I will submit, and we know we have to do it in certain numbers of pages. We found that out the hard way, but we know how to do it. We will make it part of the official federal record. I would just like to thank all the panelists, and in closing, what is being underscored here about the cuts in SNAP, I serve on the Appropriations Committee. I also fear greatly for the cuts in housing that are coming forward, the cuts that will eventually be made in transportation and transit needs for many Americans. But there is one group of Americans which have been referenced by the panel here that I do want to point out right now that are even in greater crisis, and that is our Native American brothers and sisters. Whereas many Americans were spared the protected from health care costs, both in Medicaid and Medicare, in direct cuts to benefits received. Because Native American health care was in the Department of Interior, everybody forgot. They have been in the throes of a saying that when their contract health services ran out, don't get sick after August. Now, for our Native American brothers and sisters, literally, who need diagnostic tools or need to have elective surgery, it was don't get sick after May. So I want to thank you for coming and empowering me with your words and your testimony to fight the good fight. I will let Keith make his closing remarks. I do have to leave a little bit after 3, but I want to have everyone here an opportunity to make a closing remark. So if I leave, please stay and your closing remark. Thank you very much. Keith?
Well, I think all of us want to join and thank you, Congresswoman McCollum, for pulling this together. This is an awesome panel today, and I thank you for not just today, but all the work that you do over time. You know, earlier today, I was at the Fraser Center in North Minneapolis, near my home, at Head Start. We learned Hennepin County is going to see 90 spots eliminated from Head Start. Somewhere between 10, 14 staff will be laid off. This is all part of sequester. So then come here and hear testimony, real live testimony from providers, from recipients, from all of us about the real hit to the food stamp program. Just really reminds me how we as Americans got to come together in a big way and use our power as citizens to reset the priorities of this nation. To say that, you know, government is important and that we have an obligation to the poor, and that working people's wages need to be able to cover the needs of their families, and that the people who've plowed a way for us, who've carved a path for us, who are our senior citizens, cannot be left on their own in their golden years. And this is our priority, because we can try to solve the immediate problem, but we got a more systemic problem, and it has to do with our basic attitude and orientation toward the collective, toward all of us as a nation, and what we want our nation to be. So I just want to say thank you all for the great work that you do. Very proud to see our faith community leaders here fighting the good fight despite tough odds. But as you made it very clear, the federal government cannot abandon this fight and leave it all to you. They got to stay and stick and be there. So with that, I just say thank you to everyone. And to the middle panel, I just also want to mention, too, that what you did, I think, is very courageous. It's a shame that in our society, people should feel bad about needing the help of their neighbors. I don't believe in that. I believe it is our privilege to serve you. And you know, one thing about life, sometimes you need help, sometimes you give help. It's all one big exchange. And so never feel bad that you need the help of your neighbors, because when you get yourself where you want to be, you'll be helping them. And so nobody should ever feel like, you know, I feel bad that I need help. No, it's our privilege to be of service to our neighbors who need a hand, because Lord knows we're going to need one, and we're going to be reaching for you. So with that, I just want to say, be an active citizen, and thank you very much.
Thank you. I'm supposed to be on a telephone conference right at this moment, so I will be very brief. But I want to thank you for the work that you're doing, but also for taking the time to come and testify. I think it's very important that voices are heard and that the message is carried. And we have some great representatives here who will carry that message to Washington. And so I appreciate the time that you've taken. I think it's a shame that anybody should ever go hungry in America, which is a land of prosperity. And the one thing that we can provide, or the three basic things that we can provide for all our citizens and should, is food, shelter, and health care. And if we can't do that, then I'm ashamed to say that we're not a very good government or a very compassionate and caring community. And government is about community too. So thank you for being there for the community. And I appreciate the fact that you took time out of your schedule. Thank you.
Thank you, and I wanted to thank the faith leaders for being here, and I'm really glad to see folks from the Farmers Union here as well as so many of you. And in the last panel, a couple of you mentioned, if not all three of you mentioned, that you are among those Americans who want to see the federal government balance its budget. And I would agree with you and think that most in the room would, and that is in the Constitution in Minnesota, and it is our job as legislators to balance the budget. But I don't think the fight that we're having right now is really an exercise in balancing the budget. Instead, it is an ideological fight over the size and scope of the government and what it means to come together to help people. And we've been having that fight in Minnesota as well. It's an ideological political fight, and thanks to the people of Minnesota, they changed through the election the makeup of the legislature and put in place a working group willing to set aside some of that ideology, not completely, but enough of us that are willing to do that we could actually balance the budget in a way that is going to help Minnesotans in the future. And I can only hope for that for the Congress as well. I am so glad that Representative Ellison is here and Representative McCollum is here and that you're holding this hearing. It's so important to cast a light on this and to remind us that it doesn't take that much of us to do something together that matters for the people of Minnesota and for Americans across the country, but we have to remain vigilant as citizens, as mighty citizens together to get that done. I'm grateful that you're here as well. Thank you.
Yeah, I don't want to repeat everything that's been said, but just want to kind of follow on what Congressman Ellison said, and that is that we really are very interdependent. And so if, of course, there are many reasons why we should be concerned about our neighbor, but self-interest is also one of them. And so for people sometimes who don't see that they are ever going to need, I think the message about what it means to have a healthy community is an important one, that we are all interdependent, whether directly or indirectly. And so to have a strong state and a strong nation, we have to be concerned about our neighbor. And so thank you all for participating today.
And I'll be brief. Thank you again, Congressman Ellison and Congresswoman McCollum, for this hearing. When I think the issue of nutrition, I think that, clearly this is an area that we need to invest. Because if we don't invest, it ends up coming back and costing us a lot more further down the road. And, our structures are really interconnected. If we don't fund appropriately nutrition, we're going to have higher healthcare costs and other types of costs associated with that. So I hope that Congress, and I know that you're only a couple members, cannot be, penny foolish, pound wise, penny foolish, whatever that's, yeah, whatever the saying is, because ultimately it will come back and cost us quite a bit more.
We've all been there and done that.
Yeah.
Penny wise, pound foolish.
Well, being the last one, I can ditto and ditto and ditto, right? But I truly want to thank my Congresswoman Betty McCollum for pulling this together, and my good friend Keith Ellison for coming together on an issue that is really about how do we invest in human capital, people's lives. And it's really, really important that, that we share this interest because it doesn't just impact some people or those people or them people. It is really about all of us. And that middle panel really was really shows that impact, because so often the vision that comes into people's mind is that it's those people of color, those people who don't want to work, those people who just want to take from the government. But that is not so often, it's true. It is people who are really wants the best for themselves and their community and their kids, we all sometimes fall upon hard times, and government needs to be there to fill in those areas. So my hope is that we can continue, not just as individuals, as communities, but as a government, invest in real people's lives and be there to play that part. So I just thank you all for coming and participating and sharing your voice. Thank you.
Thank you.